Ibuprofen is one of the most common ways to manage period pain, but it must be used in the right way. Today, I will show you how to use it safely to reduce period pain without harming your overall health. There is one common mistake many people make when taking ibuprofen for menstrual pain. Can you spot it later on in the video when I discuss it? Are you making that same mistake now? Don't worry if you are. I'll explain how you can avoid it. Hi, I'm Dr. Sylvia, and today we're diving into one of the simplest, yet I think frequently misunderstood method of dealing with period pain. That is ibuprofen. Ibuprofen is an easy go-to drug for many of us, but are you using it correctly to get the best results? In this video, I'll share the safest way to manage period pain with ibuprofen, how to avoid common mistakes, and tips for maximizing relief so that you can get back to yourself despite being on your menstrual periods. Ibuprofen is a non-steroidal anti-inflammatory drug, or NSAID, often used to relieve pain, reduce inflammation, or lower a fever or high body temperature. Period pains are the painful cramps in the lower abdomen and pelvis that some women experience during their menstrual cycle. A big caveat here, because women experience period pains quite differently. From some ladies getting very little or no pain at all during their periods to quite severe and distressing painful periods. Severe period pain is never normal or to be ignored. Check out my video here where we discuss the causes of period pain and even natural ways to find relief. If your menstrual period is causing pain that prevents your day-to-day activities for hours or days, or it's associated with a very heavy blood flow, please see your doctor to assess this further. Ibuprofen is a drug that prevents the production of prostaglandins. Yes, these are those same chemicals that cause the excess cramping in the womb, leading to pain. It has other effects, for example, relieving swelling, inflammation, and fever. Here's an interesting fact about ibuprofen from a clinical study. Single-dose studies show that ibuprofen liquid gels start relieving pain in about 30 minutes. A 400 milligram dose of ibuprofen liquid gels works faster and provides better pain relief than 1,000 milligrams of paracetamol tablets. The time difference for when the pain relief starts is small, between 0.6 and just under 15 minutes. However, a 200 milligram dose of ibuprofen liquid gels works about the same as 1,000 milligram of paracetamol in how quickly the pain relief begins. Okay, so let's take a look at how to get the best out of ibuprofen for period pain relief. First, timing. Ideally, start ibuprofen 24 hours before your period begins for maximum effectiveness. Of course, this means that you have an idea of around when your next period will come, which is common for girls with regular menstrual cycles. The benefit of this is that ibuprofen is already circulating to counteract the production of excess prostaglandin. I would especially recommend this if you routinely get uncomfortable when the periods first begin. With primary dysmenorrhea, the pain usually starts in the lower abdomen shortly before or at the time the menstrual flow starts, and it can continue for up to 3 days. So dosing up early can mean that you avoid severe pain, and the duration that you need to have the ibuprofen might even be reduced. If you practice this, you shouldn't really need to use the ibuprofen for more than 3 or 4 days in the cycle. The next thing to understand is that there is a maximum dose you can take every day before ibuprofen becomes harmful. This maximum daily dose varies for adult women and young girls. If you exceed this dose, it can lead to uncomfortable and serious health problems, including acid reflux, stomach ulcers, bleeding from the gut, and kidney damage, just to name a few. Once your symptoms have settled, you can just stop the drug. No need to continue or to wean yourself gradually off it. This next factor is very important. Pair ibuprofen with food. Thanks to its irritant effect on the stomach lining, the standard advice is to take ibuprofen with a meal or just after eating. This would help to reduce the risk of stomach irritation. A tip for taking ibuprofen is that the liquid-filled capsules or liquid gels are slightly more effective than the standard tablets because the drug gets quicker into the bloodstream with the liquid gels. How about when you shouldn't use ibuprofen? So now that you know the best way to use ibuprofen for period pains, let's make an important mention about who should not use ibuprofen. If you have conditions like asthma, you are advised not to use ibuprofen because in some asthmatics it might provoke wheezing or breathing difficulty. We also advise you to avoid it in pregnancy unless under medical supervision, or if you're taking certain other medications such as aspirin, some steroids or high blood pressure medications after using the tablet mifepristone and other conditions. So what are your alternatives if ibuprofen doesn't work? So I've just got a couple more minutes in this video to tell you what to do if ibuprofen is not effective. It is a highly effective pain reliever, but for some of us it doesn't do the trick. Again, don't forget to check out my video where I discuss natural options for period pain relief, including heat therapy, using a TENS machine, even some herbal remedies. But yes, you may need to see your doctor for alternative prescription options, and these may include stronger anti-inflammatory medicines or others that can be hormonal or non-hormonal options. But it's got to be following an assessment to ensure that we do have the right diagnosis for the cause of your period pain. In this video, I'm looking at the use of ibuprofen for mild or moderate discomfort that usually happens in the context of something called primary dysmenorrhea, which is when there is no underlying womb abnormality contributing to the period pain. In this case, we believe that painful cramps coming from the womb develop because the body is producing excessive quantities of a substance called prostaglandin. This is most common in young girls and ladies. However, experiencing painful periods within the context of a diagnosis like fibroids or endometriosis, that is secondary dysmenorrhea, some women can still find benefit using ibuprofen. Thanks for watching. How have you been using ibuprofen? Have you picked up any useful tips from this video? What's been your experience? Let me know in the comment section below. Check out my other videos on period related issues, and I'll see you again soon.